Access to much needed health care in rural portions of Oklahoma can be a real problem. Here to explain is Jeff Hackler, Chairman of Rural Health at OSU. Welcome, my friend.
Thank you very much for having me.
I don't think we see much press about this problem with rural health and access for folks living outside the city. How big is the problem?
It's an enormous problem, and it's an enormous problem nationally. If you look at the numbers we've had, I think it's 58 rural hospital closures over the past 5 years, and that amount is double what they had in the 2 decades prior to that. So we've seen a real acceleration of problems financially with rural hospitals, and we're starting to see the same thing here in the state of Oklahoma as well. We've had financial problems with rural hospitals where they've struggled over the past couple of decades. But things over the past few years have really pushed them closer to that edge of the cliff.
You know, a lot of folks, when you say rural health, the first thing they're going to think about is Doc from Gunsmoke. Mm-hmm. The buggy, the horse, the guy that made house calls, which, stopped years ago. But we have some fine doctors and nurses and paramedics and all that are out in the rural parts of Oklahoma. But hospital care is getting to be a problem, from what I hear.
Absolutely it is, and not to gloss over the physician shortage issue either. There's tremendous physician shortage across Oklahoma. We're ranked 48th nationally for the lack of primary care physicians for our total population.
I did not know that.
That's true, and if you look at how that impacts rural hospitals, it has a very direct impact because those hospitals need physicians to work within their walls, of course, but they also need those physicians to refer patients into their facilities. Mm-hmm. And so the numbers I've seen have been that a rural physician can have an impact on a rural hospital of about $750,000 annually in revenue. So I really think the two issues are very closely tied. When you've got a physician shortage problem, you're also going to have rural hospitals that struggle financially. And you add that in on top of a state that has such health care issues in general. We're in the bottom 10 states for so many different health care measures that a term we frequently use in rural health is that our population is older, sicker, and poorer than most populations. So mm-hmm. it all works together to have really poor health outcomes for that population.
Bet. I would appreciate it if you didn't laugh at this, but I'm old enough to remember a doctor making a house call. I mean, when I was just a pup years ago. And it has changed so dramatically over the years. But then, too, it has improved over the years. Healthcare has, taken incredible strides. Now, there's a science to just seeing the doctor, the art of getting in Tulsa or Oklahoma City. I can't even begin to imagine what folks in the rural part of the state must face.
That's precisely right. There are shortages across the entire state, but when you look at what's going on in rural areas, there are 75% more people per primary care physician in rural areas as there are in urban areas. So it's that much more difficult to gain access to a physician. There are more folks who are uninsured in rural areas, so they can't get into those doors because they don't have health insurance. They live farther away from the physician. You add all those things in together, that makes access such a big challenge for rural populations.
And you add to that accidents on the highways, accidents at work. We've got more shoreline in the state than any other state in the union. So you've got boating accidents, that are going to contribute. And folks need, in many, many cases, immediate health care, and they've got to be transported, which just adds to the problem.
Right. It doesn't just affect any crisis of healthcare in rural Oklahoma. Doesn't just affect rural citizens. We've got folks from Tulsa and Oklahoma City who go out to rural areas where they like to go on weekends to the lake. Mm-hmm. They like to drive on vacation, so they travel through there. So, when we have challenges in rural Oklahoma in terms of hospitals and physicians, it affects everybody in our state.
How did we get here? How did we get to this state?
I think part of it is really just the way the financial reimbursement system is set up for some of these hospitals. They struggle because if you're a particularly small hospital, you're always going to have challenges with your volume. You're serving a low populated portion of the state. Mm-hmm. You don't have a lot of patients, so just almost by definition, you're going to have reimbursement issues. Congress has made a specific classification of hospital called the critical access hospital. Mm-hmm. And if you're classified as critical access hospital, you have to meet eligibility criteria. So you have to be smaller than 25 beds, you have to be located in a rural area, and if you meet those qualifications, you're 35 miles away from the next nearest hospital, you can get cost-based reimbursement. So instead of getting volume-based reimbursement, it switches to this cost-based reimbursement model, which is good because it helps them keep their heads above water when they have low volume. The problem you create with that, though, is that you're always just getting reimbursed your costs. And if you're just barely keeping your head above water, you've got to make up money with the remainder of your patient population. Now, for critical access hospitals, their inpatient population for which they're getting cost-based reimbursement is about 80% Medicare. That leaves 20% where they can make up that difference and make some money, actually. When you've got an uninsured population that's anywhere from 8-10% or higher, then it's tough to make up the ground of when you're just getting cost-based reimbursement.
Golly, I mean, the domino effect of this is phenomenal. To go back to something you cited earlier about a critical doctor shortage here, would tell us it's past critical in rural areas.
Absolutely. There are 77 counties in the state of Oklahoma, and I believe there are only 14 or 15 that don't have some type of shortage designation for health professionals. So this is everywhere in our state, and it's, you know, as a medical school, it's part of our mission to produce primary care physicians for rural and underserved Oklahoma. And we've been able to increase class size over the past several years, and that's helped us produce more graduates. But you have to combine that with our graduates need to go on to train in residency programs across the state. If you look at nationally what's happening and you look at what's happening here in the state of Oklahoma, we're producing more graduates from medical schools than there are available slots for residency programs. And so you can't produce physicians unless there are residency programs for all of those graduates to train. And that's been part of our focus over the past 7 to 10 years, is figuring out ways that we can increase the number of residency programs where our graduates can train. And so we've, over the past 7 years, helped develop more than probably 125 residency slots where our graduates can train. And they're not just training in Oklahoma City and Tulsa. We're trying to get those programs out where the doctors are most needed, so that when they graduate from those residency programs, they're going to stay where they've trained. That's the statistics you hear, is that a doctor or a physician who trains in a residency program is likely to stay within 100 miles of that training location. So that's why we need them spread throughout our state.
You know, I'm sitting here thinking about other areas, and it's something you tapped on just briefly, but we have a lot of folk here who hunt pheasant, quail, deer. We have a lot of folk who fish. They're going to be out in the wild, and you know, there's an accident. It almost makes you want to just stay home, you know, and shut the door.
It's really scary. And you think about the people who live in rural Oklahoma, a large reason they're living in rural Oklahoma is because of the industry that began in this state. Is, you know, we have a lot of agriculture, we have a lot of energy in this state. And so they need to be out there producing for us, and we need to make sure that they've got available health care, because the statistics you hear suggest that, you know, the farther you have to travel to a hospital for care, the more likely that you're going to have serious consequences from that injury. And so it's really important that we try to have a hospital within 30 minutes, you know, ideally, so that they don't have to travel, say, an hour or 2 hours into Tulsa or Oklahoma City for the care that they need.
I got to ask you, it would seem to me like this problem is so incredibly large that someone from our congressional delegation needs to notice. Has any lobbying been done on the part of rural health care toward Washington? Absolutely.
You know, we personally at OSU Center for Rural Health aren't engaged directly in that lobbying, but there are a lot of organizations nationally. There's the National Rural Health Association that takes a lead on protecting rural hospitals and rural providers in general. Here within the state, Oklahoma Hospital Association does as well. So there are folks fighting this fight, but really part of the problem is reflected in Oklahoma is what's going on nationally, is that we're becoming more and more urban. And so when you have legislators in Washington, D.C., I think the perspective is they're looking at things from an urban perspective rather than that rural perspective that prevailed, several decades ago. And I think part of the consequence you're seeing is that we're passing legislation that is adversely affecting rural health care, and they're having to clean it up after the fact. And that's a scary place to be.
It's beyond scary. It really is. Well, I hope this doesn't, and we've only got about 30 seconds or so, I hope this doesn't diminish the incoming young people who want to get into the medical field. I hope that they still have that urge.
I think absolutely. When we speak to our students, it's incredibly impressive to me to see how many of them are getting into it because they want to make a difference out in the community. And I think there's such an opportunity to make a difference. When you're a rural physician, you can go out there, you're caring for an entire community, you're helping support that hospital.
You bet.
That hospital is part of the economic driver for that community. So
you're all one family, really.
Absolutely.
Hey, thank you.
Hey, thank you very much.
Appreciate it. We'll do this again.
I would love to.
I want to hear more from you down the road. Now, up next, Tulsa Opera is known from New York to Los Angeles and all points in between. We're lucky to have this company call Tulsa home. And up next, we'll take a look at what's coming when we come back.
All right.
Good.
Thank you.
Now we can pop.